Every 40 seconds somewhere in America, someone suffers a stroke, and more than 150,000 people a year die. Tonight, learn what you need to know about these deadly brain attacks. Welcome to Stroke Smart, presented by the Penn State Hershey Clinical Neuroscience Institute. A chance to speak directly with leading physicians about the prevention, treatment, and warning signs of a stroke.
Good evening and thanks for joining us. Strokes can occur at any age, but fewer than 1 in 5 Americans can identify even one stroke symptom. Stroke is the third leading cause of death in the United States and the leading cause of serious long-term disability. Tonight, a panel of medical experts are here to answer questions you might have about strokes. Joining us in the studio is Dr. Reichwein. And Dr. Reichwein is the co-director of the Penn State Hershey Stroke Center. And welcome, Doctor. And we'll be talking to you in just a few minutes. And in our ABC 27 call center, they're out there with Amanda Martin. We have a group of specialists from the Penn State Hershey Clinical Neuroscience Institute. Amanda Martin is here to tell you how to get in touch with the doctors and the nurses. Hi, Amanda.
Hi, Chuck. As you can hear, the phones are ringing. They're already busy answering a lot of questions. And we invite you over the next 30 minutes to go ahead and call in because all of these experts here, doctors and nurses from Penn State Hershey Medical Center, are here to answer your questions about stroke. And just so you know how it works, your question may be shared over air, but none of your personal information will be shared as you discuss with the doctors and nurses on the phone. They'll try to give you whatever information they think may be most helpful to you. We are also going to try to answer every question that we get. Obviously, we can't mention all of them on air, but we can tell you that everyone will follow up with you. There will be an expert that follows up with you to answer your question and try to get you more information. So once again, go ahead and call in. As you can see, they're all very busy answering the phones, but please keep trying. The number is 346-3333, and we'll check back with you in a few minutes, Chuck.
Thank you, Amanda. I've been in that room, and it gets very, very busy out there. So, Dr. Reichwein, let's begin with a very basic question. What is a stroke?
A stroke is sudden brain injury that's caused by a brain blood vessel problem. And there's two major types of stroke. One is called an ischemic stroke, which is where a blood clot blocks up a blood vessel and the brain tissue supplied by that dies over minutes to hours. This is the most common type of stroke affecting 4 out of 5 individuals. The other type of stroke is called a hemorrhagic stroke, and that's where a brain blood vessel ruptures and dispenses blood throughout the brain and surrounding tissues. That's far less common, but can be much more life-threatening.
Well, obviously not a simple answer, but not a simple procedure either. What are the major risk factors in strokes?
Many of the common risk factors that we all hear about are those, and those include high blood pressure, diabetes, high cholesterol, known blockages in your neck or brain arteries, cardiac problems to include irregular heartbeat, atrial fibrillation with advanced age, and many others. In younger stroke patients, there are some unique causes to include clotting disorders that they didn't know they had, lupus-like states, and most unique to middle-aged women, migraine with aura, smoking, and birth control use, particularly with increased age, 30s and 40s, increases a woman's risk for a stroke.
Taking the birth control at an older
Plus
age.
those, correct. Plus those other risk factors.
All right, thank you. Well, strokes can strike quietly, hitting even the healthiest of people. Immediate medical care is so important, and Amanda Martin has that story of one patient who lived through this.
You're going to get some props. Yeah.
Lewis Webster has a passion for teaching young people. He oversees student character and leadership at the Milton Hershey School.
I say I'm the glue of the school. I pull together the hidden curriculum and try to get the kids to realize what they're here for and what they're here in life for.
Lewis has some personal knowledge to go along with that, having lived through a stroke.
I always prided myself on being in good shape. Ever since I was around 13, I've played basketball or some kind of sport of running. And I've run for the last 23 years or so. So I always had running in my life too. So I had no reason to think something like this would happen to me.
Lewis had no obvious risk factors for a stroke, but in June of last year, he got on a treadmill, as he's done many times before, started running, and he didn't